1-888-8-HELP-US for your free consultation.
Welcome back. Dr. Szepiela joining us here to talk about your good health. Doctor, let's start off with this first question from a caller. They want to know, they said, my joint pain always seems to worsen in the rain and the cooler weather. Is it just me, or is there a connection?
Well, there's actually been a couple of studies published on this recently, and everyone has a relative, parent, or an injury from when they were younger that they can say, hey, this gets worse when I know it's going to rain, or hey, it's going to rain today. That's thought to be due to the barometric pressure as well as more moisture in the air, which increases the joints, the swelling inside of it, and worsens the pain. But over the past 2 years, there's been 2 different studies, and one of them says, yes, absolutely, this is what happens in there. You get increased pressure. And the other one says, no, we saw millions of people, and they don't complain more when the weather gets cold. So kind of the experts are still out in this, but at this point in time, it's hard to deny the fact that things hurt more, and you can predict the weather sometimes with your joints.
All right. Another caller wanted to know, said they have chronic pain from several injuries and surgeries, and they take opioid medications. I was asking for more at my doctor's office, and she told me that I have tolerance to the medication and might need to switch instead of increasing. Why not just give me more, they want to know.
I think that's a legitimate question for a lot of people, and especially with what's going on in the states of Ohio, Michigan, and across the nation right now. First off, your doctor's talking about tolerance to the medication. He's not telling you you're addicted to it. Those are different things that will happen. Tolerance means that your body's used to the medication, which means that if he or she just gives you more, then it's not going to do much else other than make you more tolerant to it. Addiction means that you need it all the time in that area, and that's what your physician or your healthcare provider is trying to avoid. So in that case, they'll give you a different medication, maybe of the same like an opioid medication, but be able to use less of a dose for a larger effect from it to give you more pain relief and stop the side effect of addiction or potentially dangerous side effects that these medications are known to have at this point in time. So there's a lot that's still going into this, and we're still trying to work through it and what the most appropriate thing to do with opioid medications. But right now what we try to do is stop just increasing the same medication and leading to further addiction.
All right, now our final question, about 30 seconds. I have got pain in my calf. I've had that since I got back from a vacation, and it won't go away. I didn't injure myself. I tried stretching, but that makes it worse. What should I do?
First off, any pain that you have that doesn't go away in a short period of time, no longer is a muscle pull or anything like that, it requires further evaluation. And in this case, going on a trip and being immobilized for a while, I'd look into the possibility of having a blood clot. So I'd see my health care provider and be able to rule that out, because that would be the life-threatening issue that I would be concerned about. Other than that, they'll put you on an anti-inflammatory medicine, possibly give you some things you can do to work that area to get rid of the pain.
All right. As always, Doctor, good to see you. Have a great rest of your week. We'll see you next time.
Thank you.
You bet. Coming up tomorrow on Ask the Expert, legal questions. We've got a lawyer who mans the phones, and then